Now we're going to change gears a little bit. As you may have guessed from Helen's talk and from the picture behind me, the program is called the Master of Conference Interpreting, and certainly the program, its primary goal is to train people to enter the conference interpreting market. They might then point themselves in the direction that Helen sort of spoke about for you, whether it's working for the European institutions or for a large international organization like the United Nations, or even here closer to home, working for the Government of Canada, which has a sizable staff of conference interpreters. Our program also has another feature, another goal, another objective, and that's to strengthen the kind of interpreting that's done in other sectors, like court interpreting, but also healthcare interpreting. And so that's what I'd like to talk to you about tonight, to focus a little bit on interpreting specifically in the healthcare sector. And to do that, I think I'd like to start off just by showing you a video. And I will caution you by saying that unfortunately I'm not able to turn off the lights, and so the view that you have may be just a little bit hard to make out. But I had a look at this earlier on, and it wasn't too bad. So just to give you a sense of the power of the thing that we're talking about, here we go. That was the video, and just a couple of remarks about it. It's getting a little bit long in the tooth. I think that was produced maybe 15 or so years ago. I remember seeing it on television quite a while back. The company that produced the video is still in existence, and they're one of the largest companies working in over-the-phone interpretation. It's Language Line Services. They're based in Monterey, California. What's interesting is they also make available an actual clip of an interpreter doing just that, delivering or helping to deliver a baby when a woman gets stuck in traffic and can't make it to the hospital. I don't know about you, but I have seen this commercial now probably upwards of 40 times, and every time I look at it, I still get goosebumps, and I feel the hair in the back of my neck start to rise. And I think it sends a very powerful message about the importance of interpretation, especially in a country like Canada. How many of you, because I'm looking at faces, how many of you have either come to this country yourself, or maybe you're the son or the daughter of somebody who's come to this country, who has faced that really agonizing moment as you've tried to get some service or good or do something that was absolutely essential to your making a livelihood and making your way in this country, only to be confronted with a language barrier? I suspect that most of you in this room, put up your hand just for fun. Yeah, so lots of us have been through that experience. Lots of us know how utterly frustrating and discouraging and fear-inducing it can be, and it doesn't have to be that way. We are a country of immigrants. We rely on immigration to make this country work, and if we're serious, absolutely serious, about giving everybody who's here an equal chance to integrate themselves into the fabric of Canadian society, then we absolutely need to have good, high-quality, professional interpreting services like these, so that everybody can have that kind of positive healthcare outcome that we wind up with in this video. And just before I go on, the video, believe it or not, was filmed in Toronto. I don't know if you noticed it, the visuals aren't so good, but the police officer, the badge on his shoulder is actually the Metropolitan Toronto Police Service. So the video was filmed here. All right, so one of the things that I would argue for those of you in the room, some of you may be relatively new to Canada, and you may be saying to yourself, you know what, I'm struggling a little bit to find that first entry into the job market. And when we start talking to those people who are already working in healthcare interpreting, or sometimes in court interpreting as well, we notice that very often they may have had training or education in their home country, and they find that this is one easy way for them to get into the job market. And so our training program has been set up with a number of profiles in mind, one of which is people who have some training in healthcare. If you don't have training in healthcare, don't worry, it's not the end of the road. You can certainly come into the program. But for those that do have background perhaps as a healthcare professional trained in their home country, then we'd like to reach out, make sort of a special effort to reach out to people like you. The other thing that we're going to do in the program, and I'll explain a little bit more of this, is help you forge a way to professional certification. The training that we're offering is multilingual. We'll be working with English and French, yes, We also are guaranteed to work with 3 other languages, and that's Mandarin, Spanish, and Portuguese. Depending on demand, if we get enough students who are saying to us, yes, I want to do this, we can also run the program with Russian, with Arabic, and potentially with Cantonese. And I'll get into this in a moment, but I would argue that our program is a springboard to other activities, other types of work outside of interpreting. Okay, so the Glendon program in a nutshell. It's a 2-year master program, and in year 1, things look a little bit like this. We're going to ask you to take an equal number of courses that are specialized in the healthcare setting, in the court setting, and in the conference setting. So that is a number of courses, 2 in each setting, that are specifically about interpreting. They'll train you to actually do interpreting between your languages. And then there are a couple of courses on the side designed to give you the background knowledge that you need to work in a particular setting. If that's enough for you, and you say to yourself, you know what, I think I need to get out there into the job market, you can leave the program at the end of year 1, and you can earn what we're calling the graduate diploma in general interpreting. The other thing I should say about year 1 is it's being delivered entirely in an online format. We fast forward to year 2, and year 2 looks like this. Year 2 is focused exclusively on conference interpreting, and so all of the courses that you would take would be looking at the kind of interpreting to be done in the conference setting. At the end of year 2, you'd earn the full degree, the Master of Conference Interpreting. Year 2 will be delivered entirely in a face-to-face mode, in a regular classroom, actually in a new interpreting lab that they're building for us just down the hallway. The other thing I'll mention just in terms of program structure, at the end of both years, we're going to try and line up work placements for you. So we already have a number of partners in healthcare. So some of the major teaching hospitals, some of the community health centers that specialize in providing care to newcomers, they've lined up at our door and said, can we take some of your students at the end of that first year? And similarly, we've been having a couple of discussions with the Government of Canada, but also with some other bodies about taking our students towards the end of year 2. So trying to provide you not just with training in the classroom, but with some connections to the outside world. Okay. Just a couple of statistics now about the profession and about the demand for it. So this is really interesting. The global market for outsourced language services was worth more than, and this is in the United States, this is not looking worldwide, was $33 billion in this is what's projected for 2012. Okay, so some people have a tendency to say that translation and interpreting are recession-proof areas. We've been looking at some of the numbers. The U.S. Bureau of Labor estimates there will be 83,000 jobs in translation and interpreting by 2020. So we'll get into this in a second. I think the next statistic is about, yes, growth. So this represents a growth of 42% from 2010 to 2020, and that's significantly higher. The average in other professions is 13%. So some of the people are looking at the whole translation and interpreting sector, stepping back and saying, wow, incredible opportunities here. And a very interesting piece of news that came along recently, and I won't take you to the link, but here in Ontario, you may know that to provide healthcare services, we of course have the government, the Ontario Ministry of Health and Long-Term Care. We also then, of course, have the administrations in the hospitals. There's an intermediate level of government. They're called the Local Health Integrated Networks, which is kind of a hard to understand name, but basically they're this intermediate level that watches over hospitals and other service providers in a district. Our LIN, as they're called, here in Toronto Central, has decided in a pilot project to provide interpreting services for free to the hospitals in its catchment area. Basically what this amounts to is covering interpreting, the cost of interpreting, the same way that the government is covering the cost of doctors and nurses. So in essence, neither the hospital nor the patient is having to pay for interpreting services. They're being provided as part of an integrated healthcare service. This is absolutely revolutionary, and we're hoping that this sort of potential is made available province-wide, but also expanded outside of Ontario. Okay, So the other couple of things about the program, if you decide to finish in year one, and you go out and you work in the job market for a bit, and then maybe you're looking around and saying, I want other opportunities. You can come back to the university. So in our program, for example, you don't need to do year two immediately on the heels of year one. You can go out, practice in the profession, work for a bit, come back to us and do year two. Alternatively, you're going to be taking some courses in our program that are parts of other degrees at York and at Glendon. So, for example, here at Glendon we have a program called the Master of Public and International Affairs. Some of the courses that you'd be taking in the interpreting program are also shared with the MPIA, and you could potentially get advanced standing into that program. Same sort of thing, there's a program on the other campus, the Master of Public Policy, Administration, and Law. And they do a lot. They train people who become administrators in the court system. So again, you could come in, take our first year of training, exit, go and work, and then come back to us. Maybe you'd seek entry to the second program, the MPAL, and then you'd wind up back in the court system, working as an administrator. Maybe you'd coordinate an interpreting service, that sort of thing. We've also had a number of conversations with some of the private sector companies that say, we look at the pathway of interpreters that come in to an agency, and we recognize that they do interpreting, yes, but they also do a bit of project management. They also do a bit of sales. They also do a bit of marketing. They also do a bit of some other part of a normal business operation. And then we're starting to see interpreters sidestep into other industries because they've built up, through interpreting, they've built up these skill sets in other areas that are transferable to different industries. Okay, so I won't go into too much detail about Glendon. We think it's a pretty fancy place. You've got a little bit of an introduction just by being here. Next steps. If you're interested in the program and I've satisfied your curiosity, you can go ahead and submit an application to York University. The application is online. From there, you take our aptitude test. We want to figure out who you are and do you have the beginnings of the skills that we would then help you to develop to become an interpreter. In some cases, you may have to undergo an assessment of professional English, and then some practical information. The next deadline for applications is August 15th. We pushed it back. We're going to be scheduling a few more sessions of our aptitude test, so those will be announced shortly. If we do decide that you need to do that English assessment, it'll be with the MELA test, which is offered by the Michener Institute, a healthcare training institute here in Toronto. Applications are available online. Classes start September 5th. Tuition cost, everybody wants to know about this. Tuition for a graduate program at York University is $5,500, at least right now. That's where it stands, and that would be on a yearly basis. Are we eligible, if you come to us and study, are you eligible to apply for OSAP? You bet you are. Okay, what I think I might do at this point is take 2 or 3 questions while we're all together, and then we'll break. It's been a little bit warm in here, and you've been a very attentive audience, and so maybe you can filter down and ask questions on a more informal basis, and those that need to leave can. But for now, maybe 2 or 3 questions that we'll try to respond to. Anything you want to ask me or Helen squared.
So you said the first year was online. Is it also available in class though?
So the question was, first year online, do you run it in class as well? No, we don't. Online purely. We are doing some very exciting things with online learning. So some of you who are already studying at Glendon may have taken a course online, and traditionally in the past, all of our online courses have been delivered asynchronously. In other words, you consult a website and you use static materials. So you go in on your own time, the other people aren't necessarily accessing the website at the same time. The only opportunities for interaction are written. So in the interpreting program, we're going to do things a little bit differently. There'll be some components of the courses that you'll be taking that will be delivered asynchronously in that same mode, but we're also delivering parts of the courses in a synchronous mode. So we have a platform called Adobe Connect. It's a bit like Skype, but on steroids. So basically you can come online, you can turn on a camera, use a headset and a microphone, you'll see your teacher, you'll see your other classmates, you'll be able to interact with them, And we're finding, as we prepare to host our students, to have them come in September, we just did our first iteration, our first administration of the aptitude test, and we were really, really pleasantly surprised to see just how much we can really do online. It's getting very close to the point where there's very little that we would do face-to-face in a classroom that we cannot simulate or emulate in the online environment. So I think people are going to find that online environment very interesting, very exciting. The other reason why we decided not to do it face-to-face is that I guarantee you in 5 to 10 years, most, maybe all, the work that interpreters are doing, they're going to be doing it remotely. And so I think you're going to find that a lot of interpretation work is going to be done in an environment very, very similar to the one we're using to deliver the courses. So all the more reason to make sure you're familiar with that, comfortable with that environment, and used to using those tools. Okay, so there was another hand that went up before. At the back, please.
If we have certification from a different interpretation school, such as in healthcare, do we get any credit for those?
What are we talking? So the question was, if we have other training in interpreting, what could you do to recognize it? What are we talking about?
I have a certification at MCIS, which is
Okay. So we are at this point saying that we are willing to sit down with people and take a look at what they've done in the past and do our best to recognize it. So for example, we've been working very hard with the Office of Admissions and the Faculty of Graduate Studies. This is a graduate program, and some people who have come to us and have said, you know what, I never really completed a university degree. So those people, we can sit down with them, and we may discover, for example, that they've done maybe a little bit of university training, maybe they have some professional experience, maybe they've done some training in the community, and we will do our best to try and recognize that, but we have to look at it on a case-by-case basis. Okay, over here then, please.
For admissions, are you looking for a certain undergrad major or a certain GPA cutoff or anything?
So there is a minimum cutoff, and I think it's really reasonable. I've actually forgotten what it is, but there's an information page at the Faculty of Graduate Studies that I can point you to if you get an email contact with us, and it does tell you what the GPA is. I think you'll find, believe it or not, that it's somewhat low. And that's because your past performance scholastically is only somewhat of interest to us. By far, the thing that we're looking at the most is how you perform on our aptitude test. And so to the second part of your question, the second barrel of that was, do you want me to have training in a particular area beforehand? And I would say that we are very open-minded about this. So I think that some of the other people here might agree that there's very little training that would not be useful for somebody who then becomes an interpreter. Interpreters work in so many different places, and background knowledge of those places is very important for them. So we're not going to close off the tap. Some people will come to us via translation. Some people will come to us with a background in law, in healthcare. Some people will come to us via finance or marketing.
Or chemistry.
Or chemistry is the other example. None of those things would go to waste. All right, maybe 2 more questions and then we'll close the evening.
I just wanted to know, is this the website to download the application form?
So the question was, Andrew, inside the brochure there's a website on the inside cover. That's the website to the program. That is not to the application form. If you want to be directed to the application form, write to interpretation@glendon.yorku.ca and we'll send you the link. It's a little bit hard to find on your own, I know.
For year 2, it's an in-class face-to-face.
Yes.
But what are the hours looking like? Because it's a full-time program.
Yes.
So we talk about 20-something hours. So
Okay. So 2 ways to attack that. The first is to say, what are the number of hours? So it's a full-time program, which means that you'll be taking 5 courses a term, which means that you have each week 15 hours of contact time with your instructors. Count on at least another 15 to 30 hours of work outside of class. So it's starting to look full-time-ish, like full-time job commitment. In terms of when during the day, we're a year away from making those decisions because we're only gearing up for our first iteration of year 1. So I can't speak with any certainty. Courses at the School of Translation, you know that we tend to do most of our offerings in the evening or the late afternoon. And that's for 2 reasons. One, because sometimes our students are busy doing other things during the day, and sometimes, to be perfectly honest, our instructors are busy doing other things during the day. All of our teachers in the practical interpreting courses will be working interpreters, and from 9 to 5 they'll be, well, working. So I suspect that we'll need to do things at night as well. All right, with that I'm going to close off the formal session. Thank you very much for being here. Thank you for your interest. If there are other questions that we haven't answered, feel free to contact us at interpretation@glendon.yorku.ca. I'll hang around for just a couple of minutes if you want to talk to me one-on-one. Otherwise, thank you very much for being here.